Hi, I'm Kathleen, and I'm going to be explaining to you some of the restrictions to expect after your cataract surgery. There aren't very many, and they're talked about in the pamphlet that you were already given. The biggest one is going to be not to rub the eye. Sometimes you might expect a little bit of itching afterwards, which is normal, and it gets better after you start using the drops. The other big one is that we don't want any water in the eye. This doesn't mean that you can't wash your face or take a shower, it just means you need to keep your eye closed, and we don't want you to submerge in water like lakes, hot tubs, pools, that kind of thing, because of the bacteria risk. We also, for the first few days, want you to be careful about bending over. When you get your head below your waist, it can cause pressure and pain inside your eye, which we want to avoid. We also don't want you to lift anything extremely heavy for the same reason. So usually a good rule of thumb is nothing heavier than a basket full of laundry. You'll also be getting anesthesia the day of the procedure, which means that you'll need someone to drive you to the surgery center, wait for you there, and then drive you home. This is usually a wait of about 2 hours. We also like them to stay with you for a couple of hours afterwards, since the anesthesia can make you feel a little funny for a while. This means that you'll also need a driver the next day to bring you to your one-day post-op, because we want to make sure that all of that anesthesia leaves your system before you start operating heavy machinery. That means you can drive 2 days after your surgery unless otherwise instructed by your doctor. You can also sometimes experience double vision after the surgery because of the anesthesia and the numbing. As those leave your system, this will get better, so expect that and don't be alarmed.